How to use aspirin to unclog arteries. Did you know that aspirin can be more than just a headache remedy? How can this small pill help to unclog arteries and save lives? And do the effects happen immediately, or do they take time to manifest? The truth is that aspirin holds surprising benefits for cardiovascular health, something many people are unaware of. But how exactly does it work in our bodies to prevent heart attacks and strokes? The answer involves a fascinating and complex mechanism where aspirin acts directly on blood platelets, preventing them from forming clots that could block blood flow in the arteries. Have you ever wondered if this simple habit of taking aspirin could truly make a difference in your long-term health? Let's explore the power of this medication that for over a century continues to revolutionize medicine. Let's get started. Who invented aspirin? Many think aspirin is a recent invention, but the truth is that humanity has benefited from its active principles for thousands of years, dating back to the earliest civilizations. However, it was only in the late 19th century that it began to be synthesized in a lab and distributed on a large scale. The man responsible for this was the German chemist Felix Hoffmann, who worked for the pharmaceutical company Bayer. In 1897, Hoffmann successfully produced pure and stable acetyl salicylic acid, ASA, for the first time, initially to relieve his father's severe rheumatic pains. The new drug quickly proved to be highly effective, not only for pain relief, but also for reducing fever and inflammation. By 1899, Bayer began distributing aspirin powder to doctors, and by 1915 it was available in tablet form to the general public. Thus, one of the most popular and versatile drugs of all time was born: the natural origin of salicylic acid. Although Hoffmann was the pioneer of synthetic ASA production, knowledge of the therapeutic properties of salicylic acid, its active ingredient, dates back to ancient times. Various cultures around the world used plants rich in this substance to treat pain and fever long before the development of aspirin. The name aspirin itself has botanical roots. It derives from Spirea, a genus of shrubs whose leaves and bark contain high levels of natural salicylates. Other plants rich in these compounds include white willow bark, jasmine, almonds, peas, clover, and certain grasses. Records show that the ancient Egyptians used willow bark to relieve pain and fever more than 3,500 years ago. In ancient Greece, around 400 BC, Hippocrates, considered the father of medicine, also prescribed teas and extracts from willow leaves to treat various ailments. Interestingly, it was only in 1829 that scientists isolated salicylic acid as the actual agent responsible for the therapeutic effects of these plants, paving the way for the development of aspirin as we know it today. How does aspirin work in the body? Aspirin is a unique and fascinating drug due to its dual action in the body. It acts both as an antiplatelet agent and as an anti-inflammatory and pain reliever. Let's take a closer look at each of these mechanisms. In low doses, its primary effect is on platelets, the tiny blood cells responsible for clotting. Aspirin irreversibly blocks an enzyme called cyclooxygenase, COX, which is crucial for producing thromboxanes, substances that promote platelet aggregation. In other words, aspirin temporarily turns off the ability of platelets to clump together and form clots. This provides enormous benefits in preventing heart attacks and strokes, as it stops clots from forming and blocking the arteries that supply blood to the heart and brain. In higher doses, aspirin's anti-inflammatory and analgesic, pain-relieving effects become more pronounced. In these cases, it also inhibits COX, but reduces the synthesis of prostaglandins, molecules that cause pain, swelling, and fever at the site of injury. This is why aspirin is so effective against headaches, menstrual cramps, arthritis, and other inflammatory conditions. The great advantage of aspirin over other anti-inflammatories is that, because it permanently inhibits COX in platelets, its heart protective benefits last even at low doses. In contrast, higher doses are needed for pain relief, and the effects are temporary. Proven benefits of aspirin. Now that we understand how aspirin works, let's explore its main applications and benefits for human health. Prevention of heart attacks and strokes. This is undoubtedly aspirin's greatest benefit, saving millions of lives in recent decades. Various studies have shown that taking aspirin daily in low doses, between 75 and 325 milligrams, can reduce the risk of heart attacks and strokes by up to 20% in people at high cardiovascular risk. This includes patients who have already suffered a heart attack or stroke, secondary prevention, those with coronary artery disease, peripheral vascular disease, a history of heart surgeries, or multiple risk factors like diabetes, hypertension, high cholesterol, obesity, and smoking. In these cases, aspirin prevents clot formation by inhibiting platelet aggregation, keeping the blood thinner, and reducing the likelihood of artery blockages. Additionally, if a clot has already formed, aspirin prevents it from growing and causing more damage. Pain relief and anti-inflammatory. This is probably aspirin's most common and well-known use. In doses of 500 to 1,000 milligrams, it is extremely effective in relieving acute pain from headaches, toothaches, sore throats, menstrual cramps, muscle aches, and post-surgical pain. Besides its analgesic properties, aspirin is also a powerful anti-inflammatory, widely used to reduce fever and symptoms of conditions like colds, flu, rheumatism, arthritis, tendinitis, bursitis, and other inflammatory diseases. Its action involves inhibiting prostaglandins, substances that dilate blood vessels, increase vascular permeability, and stimulate pain nerve endings. By blocking their production, aspirin provides quick relief from painful and inflammatory symptoms. Potential in preventing certain cancers. Recent research has shown that long-term use of aspirin, typically 5 years or more, can significantly reduce the incidence and mortality of certain cancers, especially those of the colon, rectum, stomach, and esophagus. Aspirin is believed to help prevent these tumors through various mechanisms, reducing chronic inflammation that can lead to precancerous lesions, inhibiting COX-2, an enzyme associated with tumor growth, decreasing clot formation linked to metastasis, and inducing apoptosis, programmed cell death, in cancer cells. A major American study followed over 130,000 adults for 32 years and concluded that taking 0.5 to 1.5 aspirin tablets per week reduced the incidence of colon cancer by 40% compared to those who did not take aspirin. Another study estimated that aspirin could prevent 17% of all gastrointestinal cancers in the US. However, the benefits appear significant only after at least 5 years of use, and the long-term risk of bleeding remains a concern. Therefore, aspirin is not yet officially recommended for cancer prevention in the general population, but may be considered for high-risk patients, such as those with a family history or hereditary syndromes. Reducing preeclampsia in pregnancy. Preeclampsia is a serious condition affecting about 5% of pregnant women, usually after the 20th week. It is characterized by high blood pressure, protein loss in urine, and swelling in the legs, which can harm both the mother and baby if untreated. Studies show that taking low-dose aspirin, 60 to 150 milligrams, from the end of the first trimester can reduce the risk of preeclampsia by up to 60% in high-risk pregnant women, such as those with a previous history of the condition. Diabetes, chronic hypertension, obesity, multiple pregnancies, or autoimmune diseases. It is believed that aspirin helps prevent preeclampsia by improving placental function and blood flow between the uterus and fetus. It also reduces inflammation and oxidative stress that may contribute to the condition's development. Since it is safe in low doses and has few side effects, aspirin is increasingly recommended by obstetricians for high-risk pregnancies. However, it's important to start as early as possible, preferably before the 16th week, and continue until near delivery, always under medical supervision. Aspirin side effects and risks. Despite its numerous benefits, aspirin is not without side effects and risks, especially if used improperly or by more vulnerable individuals. The main issues associated with aspirin include gastrointestinal bleeding. This is undoubtedly the most common and potentially serious adverse effect of aspirin. Because it is an acidic drug and inhibits the production of prostaglandins that protect the stomach lining, aspirin can cause irritation, erosion, and even bleeding or perforation of the stomach and intestines. It's estimated that up to 60% of regular aspirin users develop microlesions in the digestive tract, and about 2 to 4% suffer more severe complications like ulcers and bleeding. The risk is even higher in older adults, those using high doses, or those taking aspirin with other anti-inflammatories or alcohol. To minimize these effects, it is recommended to take aspirin with food or milk, avoid chewing the tablets, not lie down immediately after taking it, and in some cases, combine it with a stomach protector like omeprazole or ranitidine. Patients with a history of ulcers or digestive problems should exercise even more caution and discuss alternatives with their doctor. Hemorrhages and bruising. Due to its antiplatelet effect, aspirin can also increase the risk of bleeding in other parts of the body besides the stomach, such as the nose, gums, uterus, heavier menstruation, eyes, and more rarely, the brain, intracranial hemorrhage. It's also common for regular aspirin users to notice easier bruising, purple marks on the skin, due to light trauma. Surgical procedures, dental work, and invasive exams can also be complicated by excessive bleeding. Therefore, it's essential to inform all healthcare professionals about aspirin use before any procedure. In general, it's recommended to stop aspirin at least 7 days before elective surgeries and 3 days before dental work. For emergency surgeries, platelet transfusions may be needed, allergic reactions, and asthma. Some people are hypersensitive to aspirin and other anti-inflammatories due to a condition known as aspirin-exacerbated respiratory disease, AERD, which affects 10 to 20% of asthmatics and people with nasal polyps. In these cases, aspirin can trigger severe allergic reactions such as bronchospasm, wheezing and shortness of breath, hives, tongue and throat swelling, low blood pressure, and even anaphylactic shock. These reactions usually appear 3 to 4 hours after taking the medication. Therefore, individuals with a history of asthma, rhinitis, polyps, and allergies should be extra cautious when starting aspirin and stay alert for suggestive symptoms. In some cases, an oral challenge test with progressive doses may be needed to confirm hypersensitivity before permanently discontinuing the medication. Reyes syndrome in children. Reyes syndrome is a rare but very serious condition that primarily affects children and adolescents who take aspirin during viral infections like the flu or chickenpox. It causes rapidly progressive brain and liver damage, leading to brain swelling, seizures, coma, and even death in 20–40% of cases. Because of this risk, starting in the 1980s, aspirin was formally contraindicated for children under 12 with feverish viral infections. For symptomatic relief in these cases, acetaminophen or ibuprofen in weight-appropriate doses should be used. Children with suspected Reyes syndrome must be promptly taken to the emergency room for supportive ventilation, metabolic correction, anticonvulsants, and, in severe cases, monitoring of intracranial pressure. The earlier the diagnosis and treatment, the better the chances of recovery without lasting effects. Who should and who should not take aspirin? Based on what we've covered, we can outline the profile of patients who would benefit most from prophylactic aspirin and those who should avoid it or use it with extreme caution. Should take aspirin, always under medical supervision. Patients with a history of heart attack, angina, stroke, or peripheral artery disease, secondary prevention. Patients with multiple cardiovascular risk factors, diabetes, hypertension, dyslipidemia, obesity, smoking. Patients who have undergone heart bypass surgeries, bypass grafting, or angioplasty. Patients with atrial fibrillation and a contraindication to oral anticoagulants. Pregnant women at high risk for preeclampsia in low doses starting in the second trimester. Patients with a strong family history or hereditary syndromes associated with colorectal cancer. Should not take aspirin or use with great caution. People at low cardiovascular risk without significant risk factors. Children and adolescents with febrile viral infections, risk of Reyes syndrome. Individuals with a history of stomach or duodenal ulcers or gastrointestinal bleeding. People with clotting disorders, thrombocytopenia, or on anticoagulants. Patients with severe chronic kidney failure, risk of toxicity. Asthmatics, people with atopic allergies, and those with a history of allergic reactions to anti-inflammatories. Pregnant women at risk of placental abruption or nearing delivery. It is important to emphasize that the decision to start, continue, or discontinue aspirin should always be individualized and discussed with a doctor, taking into account each patient's risks, benefits, and unique circumstances. Dosage adjustments, alternative treatments, and preventive measures should also be evaluated on a case-by-case basis. Aspirin drug interactions. Another crucial aspect of using aspirin safely is being aware of its possible interactions with other medications, which can amplify or inhibit its effects and increase the risk of adverse events. Some of the most relevant interactions include non-steroidal anti-inflammatory drugs, NSAIDs. Using aspirin with ibuprofen, naproxen, diclofenac, and other NSAIDs significantly increases the risk of gastrointestinal lesions and bleeding. Safer pain relievers, such as acetaminophen, should be preferred. Oral anticoagulants. Aspirin can enhance the anticoagulant effect of warfarin, dabigatran, and factor XA inhibitors, increasing the risk of bleeding. This combination should only be used under strict medical supervision, with frequent INR monitoring and dose adjustments. Corticosteroids. Combining aspirin with corticosteroids like prednisone increases the ulcerogenic and bleeding potential in the digestive tract. A stomach protector or dose reduction may be necessary. Antihypertensives. Aspirin can reduce the effect of some blood pressure medications such as ACE inhibitors, captopril, enalapril, and beta blockers, atenolol, propranolol. Dosage adjustments and closer blood pressure monitoring may be needed. Methotrexate. Aspirin decreases the renal excretion of methotrexate, raising its blood levels and the risk of hematologic and liver toxicity. This interaction is dose-dependent and may require adjusting the methotrexate dose or switching to another anti-inflammatory. Antidepressants. The combined use of aspirin with selective serotonin reuptake inhibitors, SSRIs, like fluoxetine and sertraline, increases the risk of bleeding, especially in the gastrointestinal tract. Caution and clinical monitoring are recommended. These are just a few of the many possible interactions with aspirin. To minimize these risks, it is essential to keep an updated list of all medications in use, including herbal supplements and over-the-counter products, and present it at every medical appointment. Pharmacists can also help identify and manage potential interactions. New perspectives and research on aspirin. Even after more than 120 years since its discovery, aspirin continues to be the subject of numerous studies aiming to expand its benefits and clarify its mechanisms of action. Some of the most promising areas of research include cancer prevention. Large prospective studies have reinforced aspirin's potential in the chemoprevention of tumors, especially gastrointestinal cancers. New clinical trials seek to define the ideal dosage and duration of therapy and identify biomarkers of risk and response. Dementia prevention. Evidence suggests that aspirin may reduce neuroinflammation and the aggregation of proteins involved in Alzheimer's disease. A major Australian study is testing the prolonged use of aspirin in older adults at high risk of dementia. Personalized antiplatelet therapy. Pharmacogenetics is a field that aims to identify genetic variations that influence individual responses to aspirin. Some patients appear to be resistant to its antiplatelet effects, which can compromise the prevention of cardiovascular events. Genetic and platelet function tests may guide therapy in the future. New delivery systems. Researchers are developing modified release formulations of aspirin, such as coated tablets and microparticles, which allow for more gradual and localized absorption. The goal is to reduce gastric irritation and increase treatment adherence. Pharmacological combinations. Studies are exploring the synergistic potential of aspirin with other agents, such as proton pump inhibitors, omeprazole, statins, simvastatin, and clopidogrel. These combinations may amplify cardioprotective benefits and reduce adverse effects. It is important to note that despite these promising perspectives, aspirin should not yet be used for primary prevention of cancer or dementia without a clear medical recommendation. The risks and benefits should always be weighed individually, considering factors such as age, medical history, lifestyle, and patient preferences. Practical guidelines for aspirin use. If you and your doctor decide that the benefits of aspirin outweigh the risks in your case, it's crucial to follow a few guidelines to minimize problems and optimize results. Always take aspirin with a full stomach, preferably with meals. This helps reduce gastric irritation. Do not chew, crush, or break tablets. This can speed absorption and increase the risk of stomach damage. For elective surgeries or dental procedures, stop aspirin at least 7 days beforehand or as directed by your doctor. Inform all healthcare professionals about aspirin use, especially before invasive exams, emergency surgeries, or if you experience symptoms of bleeding. Be alert to warning signs like dark stools, vomiting blood, severe abdominal pain, dizziness, or prolonged bleeding. Seek immediate medical attention if you experience any of these symptoms. Avoid using other anti-inflammatories on your own. If necessary, opt for acetaminophen for occasional pain relief. Maintain a healthy lifestyle to maximize aspirin's benefits. This includes a balanced diet, regular exercise, weight control, stress management, quitting smoking, and moderating alcohol consumption. Strictly follow the doses and schedules prescribed by your doctor. Do not increase, decrease, or stop treatment on your own. Attend follow-up appointments and complete any recommended tests to monitor the effectiveness and safety of the therapy. Discuss any doubts or concerns with your doctor. A good doctor-patient relationship is essential for successful treatment. Conclusion. Aspirin is undoubtedly one of the most fascinating and versatile drugs in medical history. Its anti-inflammatory, analgesic, and antiplatelet properties have benefited millions of people for more than a century, preventing heart attacks, strokes, relieving pain, and possibly even reducing the risk of certain cancers. However, like any medication, aspirin also presents risks and potentially serious side effects, especially in more susceptible individuals. Gastrointestinal bleeding, hemorrhages, allergic reactions, and drug interactions are some of the most common problems associated with its improper use. Therefore, the decision to start or continue aspirin therapy should always be individualized and based on a careful analysis of the risks and benefits for each patient. Factors like age, medical history, lifestyle, and concurrent medications should all be considered. For those who benefit from prophylactic aspirin, it is essential to follow medical advice regarding doses, timing, and precautions to minimize side effects. Maintaining a healthy lifestyle, regularly monitoring treatment effectiveness and safety, and informing all healthcare providers about aspirin use are also crucial steps. With ongoing research, it is possible that in the near future we will discover even more applications and benefits of aspirin, such as dementia prevention and personalized treatments based on each individual's genetic profile. At the same time, new delivery systems and pharmacological combinations could make its use even safer and more convenient. Don't forget to subscribe to the channel. I wish you great health, wealth, and happiness. See you in the next video.